20 out of 26 persons who tested positive for the coronavirus in the Upper East region have now fully recovered. Although this is good news, the regional director in charge of public health, Dr. Josephat Nyuzagli, is worried the recovered patients could face stigmatization in their various communities. To help advocate against such stigmatization in the region, the Participatory Action for Rural Development Alternatives, PARDA, has taken the initiative to provide some logistics and to partner with the Ghana Health Service to educate people in rural communities. Correspondent Albert Story has more.
The Participatory Action for Rural Development Alternatives, PARDA, is a development-oriented non-governmental organization which operates in the northern part of Ghana, providing opportunities for rural people to access quality health, education, sustainable livelihoods, and other social amenities. As part of their contribution to the fight against the spread of the coronavirus, PARDA donated some personal protective equipment to the Upper East Regional Health Directorate. At a brief ceremony to hand over the items, the Upper East Regional Director in charge of Public Health, Dr. Josephat Nyuzagli, said, out of the 26 persons who first tested positive for COVID-19 in the region, 20 had recovered and were discharged and sent back to their communities. He was, however, worried that though this was good news, these recovered COVID-19 patients could face stigmatization from community members or even their own family members if education was not intensified at the community level.
As a region, we have done a lot regarding our case investigations. So far, we've investigated 1,501 cases. And out of this, we've received laboratory feedback for 1,429. Out of this, 26, as you are all aware, were positive. And the remaining 1,403 were negative. Of the 26, we admitted 20 of them into our treatment center. And as we speak, they have all recovered and we've discharged them back into the communities. One issue that we have to look at as a region has to do with the stigma. And you can only fight stigma when you provide adequate information. People know about the disease, they know how to prevent it. And then we can all play our little roles to eliminate stigma in our communities.
In response to the concerns expressed by Dr. Nyuzagli, the director of PARDA, Dr. Michael Wombiego, revealed that in addition to the donation of PPE, PARDA was supporting the sensitization of people in rural communities on all issues relating to COVID-19.
Today, we are going to fight the pandemic in two ways. One way is to gather some few logistics, as you are seeing now, to give to the Ghana Health Service to be able to distribute to our target communities. Then they will use this one as part of the national prescribed protocols. And the second part entails sensitization and education. And here, PARDA is going to train some selected few within all our target communities to go out to the communities, the sections of each community, to educate them about the pandemic. Fortunately for us, we have made some jingles that we play in the various radio stations. And we have done this in 3 major languages.
The items donated by PARDA included 80 sets of personal protective clothing, 20 non-contact thermometers, 30 Veronica buckets, 400 hand sanitizers, 60 gallons of liquid soap, and 20 handheld public address systems for public sensitization purposes. They were received by the Deputy Upper East Regional Director in charge of Public Health for onward distribution to healthcare facilities in the region. For Joy News, Albert Sorry, reporting from Bolgatanga.